living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Misconceptions about hospice cause people to avoid it or even fear it. Patients can receive hospice care for up to 6 months and sometimes longer, but more than 40% of Medicare patients who use hospice are enrolled less than 2 weeks, which means they're not getting the full benefit of all hospice care has to offer. Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm your host, Lisa Sather. Stay with us. Welcome back. There's nothing easy about facing a loved one's death. That's why taking advantage of all of the care and support you can get from professionals is so important. Joining us first this morning is Anna Shaw from Easter Seals Goodwill Northern Rocky Mountain, who is going to start our discussion about hospice and everything hospice care can do to provide comfort, support, and dignity to end-of-life care. Welcome, Anna.
Thank you.
So let's start with an obvious question. Most people have probably heard of hospice care, but what exactly are we talking about?
Okay. Hospice is a specific kind of care for patients approaching the end of life. It focuses on comfort and support. It's made for a time when the patient is ready to move from curative care to palliative care. So we're not trying to cure any disease, we're just providing comfort and quality of life.
Excellent. So hospice has been around for a while. This isn't anything new, is it?
No. Hospice, the word hospice goes way back to medieval times. When you think of, there were travelers, people going to Israel, Palestine area, and if they needed a stop along the way, or if they became sick, or if people in that community were sick, they could go to what were called hospices, and they were run by monks and nuns, and were a safe place, a peaceful place for people to go and receive care.
That's awesome. So that's probably why most of us have heard of it. And when should somebody really start thinking about hospice care? A lot of people wait to avoid it. What's your advice there?
Well, it's good for everyone to know what hospice is and when it's time to make that move. And think about when you might want to make that move. If you had a diagnosis that warranted it. It's different for every person. Usually when the doctor says you have a terminal illness, you have the disease that the doctor thinks will probably end your life, and the doctor's opinion is that you may have 6 months or less. That's when you can be referred and admitted to hospice. And the doctor has to make the order, so it's not something you do without information and support. And you have a team around you.
Excellent. So how do people pay for hospice? Does insurance cover it?
Very few people pay anything for hospice. Medicare has a hospice benefit, and most of the patients that we see are Medicare patients. Medicaid also pays for hospice, and veterans benefits include hospice. Most private insurance companies have a hospice benefit. Beyond that, if someone has somehow slipped through all the cracks between those, most hospices provide care regardless of ability to pay. So if someone needed hospice and didn't have any other way to pay, most of us would just say, it's okay, we'll take care of you.
Wonderful.
Yeah.
So does hospice vary from state to state, or is it the same?
Considering that most patients are Medicare patients, we have regulations that are on the national level that we have to follow, and those are really the best practices and highest standards of care, so we apply them to all patients.
Excellent. So how does a person choose a hospice program?
That's a great question. You may have only one hospice in your community, if you live in a very small town, but you may have several. We like to tell people to go to Hospice Compare, which is a Medicare site. You can just Google Hospice Compare and you'll go right to it. that site allows you to find the hospices in your area that are Medicare approved and see actual data from surviving families of hospice patients, their responses to how their experience was with each hospice. And you can look at them side by side and find out what hospice are people having the best experience with. It's also always good to talk to people in your community, talk to your doctor, talk to your friends and neighbors, and do your research for sure. You can also always call a hospice to ask questions. I know we would always be happy to help somebody understand what we do and what they can expect.
That's awesome. So where would someone receive hospice care at?
In our part of the country, in the Western US, most hospice is delivered at the person's home. Now, their home can be a house or apartment, or it could be a nursing home or an assisted living facility. All of those are considered the patient's residence, right? So our staff, the nurses and aides and social worker and spiritual care and volunteers can go into their homes and give them a higher level of care than they would receive. Even if they're at a nursing home where they're receiving a very high level of care, hospice is a step beyond that because end-of-life care is different and intense and important. So that's how we mostly do it. Some places have residential or inpatient hospice where patients can go and stay and live in what might be called a hospice house until the end of their life. I don't think there are many of those in Montana, maybe just a couple. But most people, when you ask them what they would wish for at the end of life, want to be at home. They want to be in familiar surroundings with their special mementos and their families and the foods that they're used to. That's most comfortable for most of us. So if we can deliver care at home, we think it's great.
Absolutely. We're going to have to pause for a quick break. Thank you.
Sure.
Hope you'll stay with us. Next, we're going to talk with a member of the hospice health care team and learn a little bit about holistic approach to hospice care. What does that mean? We'll find out right after this. Don't go away.